All right. So we're going to begin by welcoming everybody to
Okay.
today's session. My name is Rebecca Pimienta. I'm a social worker and I'm the coordinator of the Caregiver Grief Connection project. So this community of practice event is organized by our project in partnership with the Canadian Centre for Caregiving Excellence, the Azrieli Foundation, and the McGill University School of Social Work, as well as the CREGÉS Research Centre and the CEUS West Central of Montreal. Caregiver Grief Connection is a project aimed at increasing the support offered to caregivers during the post-caregiving phase, as well as to the professionals and health and social service workers who support them. Today, we are focusing on a topic that we had presented in French in January, and we had received many requests to offer it in English as well. So our presenters for today, our speakers, are going to be Patrick Durivage, and Patrick is a social worker in the home care program of the CEUS West Central Montreal. He is interested in palliative care that is provided for older adults in the home care context. He also provides trainings to health and social service professionals on issues experienced by people at the end of life and by caregivers. As a research practitioner, Patrick collaborates with university partners on many research projects in the field, and he was also a commissioner to the Quebec End-of-Life Commission from 2015 to 2024 that examined issues related to end-of-life care and monitors the application of requirements related to medical assistance in dying. Patrick is a member of the McGill Council on Palliative Care and is also a founding member of the Caregiver Grief Connection project. Pam is going to be our speaker today. Pam, if you could share back the PowerPoint slide, that would be great. Because I think for now we were seeing ourselves on the
Oopsies.
screen.
Okay, hold on.
So Pam is
Um,
Pam Orzeck. She has extensive experience in clinical and community practice, having worked as a frontline social worker and research practitioner for 25 years before joining the faculty at McGill University as an associate professor in the School of Social Work. She is also the director of field education in the School of Social Work at McGill. She has been involved in many direct services and research and training and knowledge transfer on many different issues related to family caregiving and grief and bereavement and social policy. Pam is a founding member and part of the coordination team of the Caregiver Grief Connection project. So we're very happy that you're both with us today. And for everybody else who has joined us, we're happy to see that there's a good number of you. So please, if you would like to write in the chat to let us know where you're joining us from. And we also want to take a moment to acknowledge that Caregiver Grief Connection is working on unceded lands which have traditionally served as a site of meeting and exchange among diverse Indigenous peoples. These Indigenous peoples are recognized as the traditional stewards of the lands and waters on which we are located. Caregiver Grief Connection is committed to equity for Indigenous caregivers and care providers and to learning from and working with these communities. A couple logistical points is that we ask that you respect and maintain the confidentiality of something that might be shared during the session. We do not permit the use of automated AI tools, note-taking tools, but the session is being recorded and will be available afterwards on our YouTube channel. If you have questions or comments, you can write them in the chat and we will come back to them later during the discussion portion. Pam, for the next slide, so that we can have a quick look at our agenda for the session. We're going to be, well, after welcoming you all, we're going to be doing a presentation of the tool called the Cartography of Factors Influencing the Experiences of Grief, with a discussion on the factors that influence the grief experience of caregivers with Pam and Patrick. And we'll have some time for questions and a conclusion at the end. For the next slide, Pam. So if this is your first time joining us, welcome to our community of practice. Communities of practice are groups that are specifically designed to bring together professionals and practitioners who wish to better support caregivers in the health and social services sectors. These groups enable knowledge transfer, peer learning, and skill development. We do offer these sessions in English and French, and the reality is that grief experienced by caregivers is often different from that of people who are not caregivers, and that often is not recognized by our society or not known how to respond to this. So that is what led to us to create this community of practice on caregiver grief. And now I will pass the floor to Patrick to begin our discussion for today.
Hello, welcome everybody. Thank you for joining us from different parts of Canada. So it's always amazing to see where people are coming from. And thank you for joining us on this community practice on factor influencing caregiver grief. My name is Patrick. I've been working with Pam for a few decades. Let's keep it simple. Basically, it's always a pleasure having that conversation about caregiver grief. So, Pam, if you could maybe start the PowerPoint, next slide. So, Pam, in a few words, can you tell us how this tool was created to help frontline workers to identify caregiver grief factors?
Sure. So thank you, Patrick. Thank you, Rebecca. And thank you to Zelda, who may or may not be in the audience, but who's our other team member. We are the Caregiver Grief Connection team, and we've been working on this issue for quite some time. This cartography is really the work of Dr. Isabelle Van Pevenage, a brilliant work of Dr. Van Pevenage, which began when her sister, actually, in Belgium, um, a clinical psychologist in Brussels, was working with in pediatric hospital setting, and was working with family members, parents of children who had passed away, and she was noticing that the parents had varying reactions to the losses, and she was, tried to, in her interest in supporting these families, wanted to find and systematize some kind of a way to understand their reactions and their grief. And so she developed this cartographie. And what we'll continue to talk about today and we'll look into was really the beginning of her work, which then led Isabelle when she came to CREGÉS, which is the Center for Research and Expertise on Social Gerontology at the CIUS Centre-Ouest. When she came to the CREGÉS and started working with Patrick and Zelda in palliative care, she realized that this could also benefit caregivers of older adults or of people in palliative care. And we began work which is, really, like Patrick said, has spanned decades, um, to develop, but a really comprehensive view of how to work with families, caregivers in understanding their grief and understanding the factors that influence their grief.
Mhm.
So, this is the tool which we'll go. I'm gonna just to show you that there are the factors, the dimensions are connected to these categories: the family member, the carer, the relationship, the family, the individual with an illness, the circumstances of the death, the social network, the professional and financial situation, and the health and social services environment, which are 71 factors, but there are 8 factors of complicated grief that are important to outline, and we're going to go through this as we go forward. So this is the tool. It's an incredible tool. It's basically a snapshot of the situation, and it's a tool used by clinicians with family members to help view the situation on one page to have a real understanding of what are the factors that influence the person's grief. So
Mhm.
this is
What?
a clinician's tool. The idea is to systemize our understanding, but it is a tool of the clinician. Um, a lot of times, clinicians can do it with the family member or can do it in their interventions as they go along with the family member. The idea really is to see what elements are supportive, which is considered a resource, or what could be a problem or an issue, which is what we call a barrier. So, in looking at this tool, um, we'll go over some of the elements and we'll do some case examples. Patrick, did you have another question?
Yeah, well, in terms of the how the tool was created, Isabelle Pavanage and her sister kind of did a systematic narrative review of the literature to kind of look at all the factors that influence grief. And so that's why there's a long list of factors. So when we had narrative review of the literature, bang, 71 criteria came into place. So when you saw the review, were you surprised with the amount of factors that was listed?
So that's a good point. Thank you for bringing that up. Isabel, who is a sociologist, worked tirelessly on a literature review, which has over 250 references. And you'll get links to all this at the end of this webinar. But the idea was that it is a very comprehensive and systematic review of the literature, which came up to these factors. And it also spurred or created the development of an online training in English and in French on this cartographie. So again, that'll be in the links at the end that Rebecca will put up. But the idea is that it's a tool for clinical practice, but it is based on research. And Isabel, who, as I said, is a sociologist, worked with social workers and psychologists and clinicians in the field to develop this tool. So, was there any kind of surprise? No. I think what is really interesting about this tool is that any one of these factors could be considered a resource or a barrier for people. I think the idea is that they're all neutral factors until you work with a family or a caregiver, and then you understand their experience, their identity, the meaning that caregiving had to them. I think that is the beauty of this tool. So an example of that is that, you know, the relationship between the nature of the relationship, let's say the top one, you know, the nature of the relationship with the individual, with the caregiver and the person with advanced illness. I mean, that could be a negative. It could be a barrier because there could be conflict or long-standing issues. It could be a resource because of the meaning and beauty and wonder of an incredible relationship. So any of these factors are inherently neutral until they become either a resource or a barrier. And as we look at how to complete the form, the tool, even making things or identifying things as neutral tells you something. It's a clue to the situation.
Okay. So after the literature review, I think there was also some different focus groups to see if there's other factors that could be included. So that was also put in place. So there was other factors that clinician added to the tool. Can you give some examples of some of
Sure.
the factors?
Sure. So one factor that could possibly be relevant is the time elapsed since the onset of symptoms and a diagnosis. So basically the trajectory of the illness, that could be one factor. Another thing is the living situation. Do the caregiver and care receiver live together? Do they live 20 miles apart or 5,000 miles apart? Can someone drive to get to the person's house, or do they have to take two planes? It has a big significance. And also, you know, what's the personality of the person who has an illness? Has it changed? Is it something that where the relationship was good and then the personality is changed by illness and that becomes a conflict? These are elements that have been, you know, in looking at all of this, these were added on, important things to consider in the cartography. And this cartography comes with a guide, a utilization guide, which Rebecca will put in the link, but really a very detailed utilization guide that shows you how to use this tool.
Mhm. And the guide's available in French and English, so it's on the website, and we'll give you the link in the chat, or after Rebecca will send us an email with all the documents, so you'll have an easy access to it. So Pam, for the audience, could you tell me how to fill this form?
Sure. So a part of our work is to recognize that caregiving is part of the life course, is just an extension of someone's life course. And for us, that includes bereavement and grief and the post-caregiving phase. And so this is a tool that a clinician can use before the death while the person is in caregiving situation, in active care or active caregiving. And then it can help understand the bereavement process or the grief process to see what support the person's going to need. So here's a great example. Here's a tool that a clinician can fill out. And as you see, we're color coding the issues. So green is a resource where these are elements that are helpful for the person. They are helpful in their resilience, in their adaptability. And red, although it looks orange, but red is a barrier. So something that is problematic or maybe considered problematic in the person's adaptability and resilience. In this tool, we're not using yellow. I'll show you another one where we're using yellow, where we're identifying a neutral resource that could be either resource or a barrier. So let's take an example. Physical health. An example of a physical health is that if the caregiver had been an active person or always maintained their own physical health, then in this situation, it would be a green, which is a resource, because that could help them in their adaptability, in their ability to move on. It could also be, let's say, going through grief, someone might need a lot of physical energy, and this could help them as they go forward. If, for example, the physical health was identified in red, it would mean perhaps the person had ignored their physical health while they were caregiving and became, let's say, more deconditioned or more sedentary, and then afterwards had a lack of stamina or energy, which could be problematic in managing all the grief-related issues.
So the
So
frontline
that
worker would ask the caregiver how's their health and quote it with the different colors, if either it's a resource or if it's a barrier in their caregiving and their caregiving grief.
Exactly. So the clinician would go over each and every one of these factors with the caregiver and ask about each of these elements or factors and say whether do we agree that this would be a resource for you or a barrier for you or something of neutrality. So another example is the caregiver social network. We all know that social isolation is a risk factor and that someone's social network, if it's in green, it would be a positive factor. And if it was in red, it would be a problem. Maybe they were isolated or alone, or maybe they had, sort of create a situation where it was only them and their care receiver, and they didn't have a lot of socialization. Well, that would be an indication for the clinician. So you zoom out and look at this.
Oh, that's not connected.
Look at this cartography and say for this particular person, there's more green than there is red. So it's an identifier, identification of this person's ability to manage and be able to function in their grief. A neutrality, let's say an example of a neutrality is work. For some people, work could be a refuge. They have socialization at work, they have function, they have identity, they feel productive, and for them, that's a really important part of their life. For others, demands of work, perhaps an unfriendly boss or inflexible work arrangement could be a real barrier for them. So that's some examples.
Okay,
I'm
so
going to show you.
I
Yeah,
see
go
on the
ahead.
cartography there's some that are not colored, so those are let like this. It doesn't all apply to every caregiver, I guess.
Exactly. So some of these things don't apply. Other things, maybe the clinician doesn't know yet or can't get to those questions yet. And this could be a couple of interventions, a couple of meetings to get the cartography filled out, which is fine. And remember the complicated grief factors on the bottom right. These are elements that might sway the entire cartography. If any of these issues occurred, it might be that these override any of the green and then become really complicated. And these are the caregivers who might need extra support in different ways in their grief.
Okay.
I'm going to go to another one. I'm sorry, it's not that clear on my screen. I hope it's more clear for you.
Mm-hmm. We're able
Um,
to see it.
you can see it? Okay, good.
Mm-hmm.
So this person has a little more red than the previous person. There's some elements that are added. Example, someone's artistic creativity. It's a little more negative and there's a little more barriers identified, and this person could benefit from some resources and from some referrals, but you could say, okay, this person is identifying artistic creativity. Perhaps we could refer this person to a group where they do art or some kind of creative expression group, and that might help them. Um, and then you could also look at the fact that, the social network and the family is less available. Perhaps this person would benefit from some support on a regular basis because they're limited or have some social isolation. The idea of this whole mapping process is subjectivity of the clinician. It's a clinician's tool. You're using your clinical judgment to decide with the caregiver if the factors are resources or barriers. And then, what's at the core of these interventions and how can you refer the caregiver to get the appropriate help based on these factors. Okay, next.
Okay, next slide.
Okay.
So when to fill it? I guess that's the next question.
Yeah, we're going to give lots of time for questions because some of the feedback has been that this is such an important tool and so interesting for clinicians that we want to sort of unpack it together and give you an opportunity to have questions. So basically, as I said, your clinical judgment with the person, the caregivers, to decide if something's neutral. But what's really important is the relationship between you and the caregiver. And so this tool can be used as early as possible in the care of the person. You can have a really amazing picture along the care trajectory for the caregiver based on your relationship with the caregiver. So, and this tool could be used several times across the trajectory, but it's definitely can be used before the death. It gives you a really good picture of the caregiver situation. And it can be used right after the death. And as we know, the period following the death, the caregiver is very busy with either rituals, religious rituals, or the details of all the administrative requirements. But after a few months, when everyone goes back to their lives, and some caregivers feel that they're left on their own, it might be a really good time to do the tool with the caregiver. Now, this is an important element because we, as clinicians, we don't always have access to the caregivers months after the person they cared for has died, but this is a really important piece. And I think there's more and more recognition in Quebec and Canada and internationally about the post-caregiving period where the caregiver has grief and is adapting to their new kind of normal and needs support from clinicians.
So is there any strength or challenge or limitation with the tool?
So, what a good question, Patrick. I had a slide
That
right
was the
here.
next slide.
What a good question. Okay, the strengths and the limitations of this tool. So, we think, and this is Isabel's brilliance, the neutrality of the tool is the strength of this tool. It allows for the clinician and the caregiver together to identify resources or barriers and the elements that help them adapt in their grief, in their bereavement period. It focuses on resources, which is great, and what to do with the caregiver's needs. It's pretty holistic and comprehensive, and it can be used in any setting, in a home care, in hospitals, in long-term care settings, in residence intermédiaire, in different community settings, anywhere. It's visually pleasing. It's a one pager. You can print it and use it with highlighters, red, yellow, and green highlighters, pretty easy. Um, and it's basically the clinician's judgment, which I think is a really big strength because it's the clinician who knows the caregiver and the caregiving situation really well. Some of the limitations are the temporality. So sometimes the average caregiving could be 8 to 10 years. When do you do it? How, over that time, or even if it's 2 years, there are so many changes and losses. How do you account for that? So that's one challenge. Understanding really who the caregiver is, their identity, the meaning in their life, like that takes time also to build a relationship. So that is a limitation to a tool, like a one-page tool. Knowing who's the best placed team member to go do this tool with the caregiver, and what if it's multiple team members doing it? Does that skew the results? Is it better to be one person who knows the caregiver best? And the idea of different populations, it might not a limitation, but a future challenge is to understand this tool with, let's say, parents of children or people who are newly arrived immigrants or different populations, different relationships, same-sex couples or different kinds of caregiving situations. Could be friend to friend, could be family member, could be neighbor. All these different populations can be the challenge. But the idea is to have it be a useful tool for clinicians and to better and best offer caregivers the support they need in their grief.
Hmm.
So,
So when
oh,
you're confronted to a family that has several caregivers, let's give an example, do you use one tool for the entire family or one tool per caregiver?
well, that's a good question. I'm not sure what Isabel would answer, but I would say to do one tool per person, per caregiver. That would be my suggestion. What do you think, Patrick?
I think so, because it's every caregiver within a family, they have a different rapport with that loved one that passed away, and they may have a different set of resources that are specific to their situation. So I think every caregivers that's within the one family, of course, if you know the family dynamic, it's better because you may get a sense if the family will be supportive or not, or if the communication flows well in the family. But after the death, there could be other conflict that arise that the individual cartography for each caregiver would give you some clues. And okay, for that daughter, she has that resource she could tap into. For the other sibling, it could be different challenges, different barriers they're dealing in their own personal life. So I think it's better if it's individual tools that are used for each of them.
Yeah, I totally agree with that. So I mean, we talked for, a little bit of time on this cartography, but it is free resource. You'll just have to register. It has real testimonials from bereaved caregivers and interactive examples. It's two different platforms, English and French. Very easy to use, and that amazing literature review is there, as well as the user guide. It goes over everything we just talked about. Um, and Rebecca will send the links to this after, so you have it all. And it's an incredible tool. Like it's really amazing. We're so proud to have worked with Isabel, that Isabel brought us into this project, and that that this is helping clinicians in working with bereaved caregivers.
Hmm.
So I'm gonna stop the share so we can chat. Let's chat. That's the best part of this whole thing.
Yes. Any questions from the audience? So
Any
you could always
questions?
you could either use the chat or just raise your hand and open your mic and we'll take your questions.
Hey,
There's no
Cynthia
question. Cool.
Yorio's on. Cynthia was a star in the in our training. She was in the MOOC in the tool.
Yes, Rebecca?
Hi, I just want to say that I wonder if what could be helpful for this question time is to maybe go back to that initial picture of the cartography with all the different factors
Okay.
so that people can have a look at it and just see if you have any questions about some of the specific factors,
Mhm.
if there's anything that's surprising or that you would like to understand how a clinician could assess this, or even if
Mhm.
you are a caregiver yourself, because I saw from the chat that we have a number of people that are either in this dual role of, they are working in healthcare and also taking care of a family or friend, or if you're just here out of curiosity for your own caregiving experience, what are some takeaways that they can take from looking at this cartography tool? So,
Okay, I'll get to Cynthia's question and then I'll pull up the slide. Hi, Cynthia.
Thank you. So thank you for having included me in my story in the tool. I did not have access to somebody to walk me through this process when I went through both of my caregiving experiences, and I'm just curious where in kind of the caregiver's process, how receptive they are to go through this, because so many caregivers are kind of in it and thinking outward rather than inward. So what do you have any anecdotes on what that's been like?
Okay, I'm gonna give that to Patrick. Yeah, go ahead.
Yeah,
He's a clinician more than me.
I've been using that tool a bit more, and it's not an interview you do just with a caregiver at one moment. It's throughout getting to know that caregiver throughout the course of the disease with their loved one, that you find out their reality and their resources, the barriers. So it's not like a checklist you do with the caregiver before or after the death. It's basically getting to know the caregiver reality, and you highlight those factors as you interact with them. So it's pretty hard to do that after the fact, because some people that are providing bereavement support to caregivers, they may not have the full picture, the full history of the situation. So that's why it's always better to fill it beforehand, because you have a better understanding of all the dynamics and all the criteria. And of course, healthcare workers, they don't always have the full picture. So you may not have all the factors highlighted in green or red. So you may just have an estimation of how the caregiver is doing, and it gives you a visual representation. What are the resources that caregiver could tap into when they're grieving, or challenges that they dealt with during the when they were caregivers. So if, like, the negative tool that Pam presented, you saw there was a lot of red in the healthcare factor domain. So maybe it was difficult experience for that caregiver to deal with the healthcare system. So you may not tap into that resource if that caregiver perceives that healthcare was more barrier in their journey. Maybe you'll go through community resources or to their friends or their family to get support when they're grieving. So it's a visual representation what they've been dealing with, and what they identify. And sometimes caregivers are not good to identify what's their resources or what's their challenges, because there's so much immersed in that situation. So that's why the healthcare worker is probably a better place to have that perspective. So it's like, but like I said, it takes a few. When I'm able to fill one category for a caregiver, usually I had like 3 or 4 interactions, or interviews, or meetings with them to get a better understanding what's their reality, and how challenging sometimes it is with their family members, and sometimes it's one family member that ruins the picture. So if for them they foresee that it's so challenging for that with that one individual, that they don't want to open up on that situation, so they may seek support through their friends or work colleagues, whatever it is that they perceive as a resource. So that's really what I suggest. And of course, for healthcare workers that are listening in today, you may say, wow, 71 factors plus the 8 factors for the complicated grief is a lot to enter, but it takes time to get used to the tool. So it's usually after you've done 5 or 6 of them that you get to know the tool better, and you're more equipped to kind of identify the factors. So you get more comfortable after using the tool on a few caregivers to be able to highlight the major elements that comes into play. So I hope it answers the question.
Thank you.
Thank you. That was another question.
Nisreen, and then Amy.
Hello, can you guys hear
Hello.
me okay? Hi.
Yes.
Perfect.
Hi.
Perfect.
I was just thinking about this tool and kind of like my own experience with feeling a bit some of that grief come not necessarily because my dad obviously hasn't passed away yet, but when we started getting a lot of support, like home care and stuff like that, and my caregiving tasks decreased, I struggled with that a bit because there's the grief of that, of not being able to do all of that, even though doing all of that was getting to me and I couldn't sustainably do it anymore. And so I was just wondering if like that tool can be applied in those grief, in that kind of grief where the grief of not doing as much of the practical or physical tasks of caregiving, but still being a caregiver and still being part of that. So I just, wanted to ask about that.
Well, yeah, it sounds like you're in a situation that's complicated for sure, and that's complex. And I think that part of caregiving is dealing with all those multiple losses along the way. And we actually called them compounded losses because they sort of compound on one another. And even not, like you said, not doing the tasks creates discomfort, which is really interesting. So,
Actually, Pam, if I could just jump in quickly, because I want to highlight one of the factors, Nisreen, if you have a look at the family member and carer, family member / carer box that's in the top left corner, there's a couple of different things there, but some of them are the meaning given to the caregiving experiences and meaning given to the illness and death, outlook on life, and all. I think that what you're describing would go into the meaning that is made out of you helping your father with certain tasks, and then you were able to get some help maybe from the public system, or from home care or whatever type of service it is, but that has also kind of displaced your role a little bit. And so how do you make meaning of that? How do you shift that? So all of that comes into play in the factors of how the grief that you're going through, even long before the death is happening, right? There's different types of grief throughout the trajectory, how that's impacting you and your resources and your abilities to cope on a daily basis. So sometimes the individual factors that are underneath these larger dimensions can apply for your specific situation.
Totally. Yeah, that makes sense. Thank you.
But Nisreen, your point is really good because I think it's important to highlight all the elements of the caregiving situation, not just the ones that are here, but finding ways to see yourselves in these factors as well.
Yeah, I appreciate that. Thank you.
Thank you. Amy?
Amy?
Hey, thank you for sharing this wonderful tool. You might have mentioned it earlier, but I was wondering how long the tool has been around. I'm coming from Belgium to Canada, and what are your strategies or maybe some lessons learned for getting this tool to other clinicians and caregiving support groups? Because I'd love to see it spread further.
Patrick, do you know the answer to that question?
Well, it's been around for a few years. If you look at the website where the Cartography was first created and updated in 2020. So we had a literature review done, and the document was translated in 2020. So it's been available online since then. The training, it's something that's in English. It's been done, translated last year. So it's available free online since last year. In terms of integrating it into a support group, we never experienced that element of integration into a support group. It was created more one-on-one. So the worker with the caregiver or the family to get to know them and identify the risk factors, because the protective factor, the resources, the barriers, it could give you an indication, well, is that person need more support group or more one-on-one individual session? So that tool was created to that effect, to kind of screen that's why it's more a screening tool than an assessment tool, to screen the strength and the barriers of the caregiver, to be able to identify what's the best resources they have and what type of support they will need in the future with their grief. So that's how it's created. If they're already in a support group, well, it could be I'm giving that as a suggestion. We never use it that way, but it could be looking at some of these factors of it impacts grief and how their journey could be affected by their own barriers. So it could be an open conversation about the factors. It wouldn't be like individualized, but you can mention to them, well, if you experience a caregiving relationship over many years and your health is impacted, we see that very often with a lot of caregivers, that their health and mental health is kind of put on the side because they devote their full attention to their loved ones, and their identity of caregiver may be impacted, and they may have to look at, okay, I'm not longer a caregiver, I'm grieving, and there's a shift within the family dynamic. How can I address that? So those are a few of the factors that you could consider. It could be a team for your group intervention, but the tool was really created for one-on-one to screen caregivers that are a bit more, I wouldn't say at risk, but a bit more challenged in their grief journey afterwards.
And Amy, oh yeah, go ahead, Zelda. Good.
Hi, Amy. Nice to see you. I'm just hopping in. Nice to see everybody who's here with us today. Just a quick update with regard to the Cartography and sharing it. We plan on presenting it, or Pam's probably going to present it, or all of us together, or one of us at the International Montreal Palliative Care Congress in October. So just a heads up on that. It'll be presented on the Psychosocial Day, which is Wednesday, the Wednesday where there are concurrent sessions all day long. So if any of you will be hopefully joining us during that Congress, you will see the tool also being presented there on an international audience. So we're really trying to get it out there as well. Thanks.
And we just finished the English version of the videos and that's what Cynthia was involved in, but we just finished it last summer. We got funding to do an English translation of the original French, and I think it's really great. I think they're both amazingly done. And we had testimonials and first person stories, and it was great. It was really well done. But
And
Amy, feel free to share. Feel free to share it. I mean, these are open access tools. That's our whole idea about this and our Caregiver Grief Connection, is that whatever we create is open access to any clinician and anyone who wants to use it. That was really part of our ask to our funder, is that whatever we create, we share widely so that nobody's recreating anything, and that across Canada, we all have great tools to use to benefit caregivers. And Amy, you have tools. You're working on stuff we know. So also that's really great.
The user guide that the frontline workers could use, it takes about an hour to read. The training, it's about 2 to 3 hours to complete the full training, depending on your easiness on grief. But the literature review, I read it a few times, and it takes about, it's a small document, it's like about 40, 50 pages. But it creates so much reflection on your work in grief. And so I read it, if it was a small document, it took me a few days to really fully understand, comprehend, integrate, because it's so nuanced. Because like Pam mentioned, a factor is considered neutral, but there's such disagreement in the literature in terms of what factor to include in or not in the grief journey. So it's really a very nuanced document, and made me reflect on so much of my clinical work with bereaved individuals and caregivers in terms of their own personal journey. Because Isabelle Pavonage and her sister, they're not taken to considering specific theory or model out there. They're looking at the factors, all the factors that comes into play. So they're not taking to account a specific model out there. They're looking at the factors to make it sure that we're assessing and considering all the impact of the grief at different levels. So it's really rich tool, and to comprehend it takes a few hours, I would say a day or two before you could really fully comprehend the tool. But it's really with practice that you could master the use of the tool. So I would highly recommend that you use the tool for at least 4 or 5 individuals before you get to know the tool, integrate all the factors, and that could take a few weeks to really integrate your practice. But it's really a rich tool, and every time I use it, I'm always surprised that there's so many factors that comes into play when we're grieving, and that caregivers sometimes kind of try to minimize their grief reaction to be able to carry on, but then it catches on with them. And what I like about the tool, it considers also caregivers' health, mental health. So it's like it's a broad category, but it includes so many other factors that we need to assess. So Rebecca.
Yes, thank you, Patrick. I also want to say that even if this tool doesn't make sense for you to use in your context, whether, if you're not actually actively working with caregivers, or if you don't see them in the right course in the trajectory, let's say, or if you just have a one-time call or contact with them, I think even just having this printed, and you could put it up on the wall in your office or by your desk, can be a good reminder for you as a clinician to understand all the different factors that can influence a person's experience of grief. And you don't have to go through every single one of them. I rarely have the time to do that, but just seeing all these different things, or seeing the larger dimensions or categories, can help me remember, like, oh yeah, you know what, I should make a note of how the health and social services environment is impacting their experience, or even their work, professional and financial situation. That's a really big one that we might not necessarily ask people, but can have really big impacts on the flexibility, their schedule, their availability, and how they are able to cope with the caregiving journey. So even if this is not something that you could foresee yourself using in your current work context, I think having it printed and just visually nearby to remind you of everything that comes into play could still be useful.
Yeah, good point. And I want to also add, when I used to use this with caregivers, I always thought about identity as one of the, whenever it said other in any of the categories, identity was a big piece that I noticed with caregivers, where their identities changed over time as the caregiving responsibilities grew. Their identities became a little more impacted, and that afterwards, after the death and in the caregiver grief or bereavement period, often caregivers had to either renew some identities or find some old ones or recreate a new kind of life for themselves, and this had a big impact on them. So it wasn't always obvious to caregivers that their identities were changing, and that their priorities had shifted, or that the time they spent physically and emotionally became more consumed with caregiving. But over time that happened, and then in their grief and in their bereavement, they often felt like, what do I do now, and where do I go? And I've always just been a caregiver, or it's been a caregiver for so long, and how do I find what's important to me, or how do I move on? And those are things that clinicians have to deal with as well, and help caregivers to, think about the losses and the impact that that had on their identity as humans.
Mm-hmm. Yes, definitely. I like to get a little conversation about the MAID challenges. And Rebecca, our reply, like a MAID could be part of the circumstance of death. So if it was planned, if it was discussed, if there was the place of death was chosen and prepared. So those are neutral factors. So you highlight if it was a barrier or a resource, the fact that the client, the patient decided to have it made provided at home, or it was done in the hospital setting. So were all the family member, the caregivers that were there present during the moment of death. So it could be for one caregiver, it could be traumatic. For another caregiver, it could be peaceful because they really helped the patient to have a peaceful death. So made by itself is not considered as a factor, but the circumstances around it are something to consider. And that's something you could always add in terms of other, could be other areas and other dimension. And other dimension, was there any ritual before death? Was there any preparation for the family or accompaniment? And that's also part of the family system, social network, in terms of if you look at the family members, caregivers, social networks, was there rituals? Was there spiritual or faith-based support? And for some, it could be viewed as positive, and for some, it could be negative because it's not part of their reality or their world. It was more the patients that wanted that type of support. And for some people, it could be offensive to have a priest when MAID is provided. So it's very unique for every individual. So there's no specific factor on MAID, but you look at the example I gave you, it could color many areas of the cartography. So therefore, you need to identify the factors that were associated for that caregiver and how it impacts. And yes, suffering is part of the journey of the person who's asking for MAID, but you're looking at the elements of the individual illness trajectory, the meaning of the illness and death. It could be very individualized. So for somebody who asking for MAID could be a peaceful death, or it could be viewed something different because their illness was so detrimental in their journey that affected how they view their life experience. So as you can see, the different elements are always something to consider, and that's what I like about the tool. It gives such a different perspective, not just on a specific act, but it also look at where the care was provided, how it was planned, and all the different elements will have an impact on the bereaved caregiver. If the caregiver was informed, or if the patient decided not to discuss it with their family or their loved ones because they want to make it in private and not buddy involved, well, that will definitely have an impact on the bereaved caregivers because it wasn't discussed. So you look at the different elements and you have to adapt and put the different colors in terms of, well, is that a resource or is that a barrier? The fact that they were not part of it. And that's really, you have to adapt it to every caregivers that you're helping in their grief journey. So I don't know if there's other questions. And yes, Rebecca, we'll give you some time to be able to survey the audience in terms of the next community practice we'll do in the fall.
So thank you all for joining us today. We really appreciate that you took time out of your day, whether it was your lunch hour or not. We're still very, very happy that you made some time to be here today to learn about caregiver grief. So I put a link in the chat to a very, very short survey to get your feedback on the session today and on future topics that you'd like to learn about. We are getting ready to plan the sessions that will be happening in fall 2026. We're taking a little break for July and August, but we're really looking forward to getting back into it in September to be able to continue spreading knowledge and awareness and new research and just experiences from caregivers as well. So please give us your feedback in that survey. I'll also send the link in an email soon after. if you have any questions or requests for presentations or collaborations, or if you have a case that you don't know how to approach, or if you yourself are struggling with caregiving, with grief, and you don't know where to turn, you can always reach out to us at info@caregivergrief.com, and we will do our best to find resources that can meet your needs in your region. So please be in touch with us. We love to hear from you. And we also have our website, which is caregivergrief.com, that has some resources. We're trying to populate it more, but you can follow us on Facebook and LinkedIn to be informed of future events and different resources that are available. So thank you again for joining us, and have a very nice day.
Thank you all. Have a
Thank
super
you.
day. Thanks, Patrick. Good job.
Thanks, Pam.
Thank you.
Bye-bye.
And thank
Thanks,
you all
Rebecca.
for joining us,
Bye.
and
Thank you, Zelda.
enjoy your summer.
Have a good summer.
Bye.
Bye.